We've completed the neurologic system, and now we're moving head to toe to the respiratory system. The first thing that you want to do is inspect the chest wall anteriorly and posteriorly. You're looking at the skin, and you're looking for any problems, masses, uneven chest rise, moles, bruises. You're going to look at the anterior and posterior. Everything looks intact. I don't see any problems. Next, you're going to gently palpate the area. You're looking for any possible masses, or you're looking to see if there's any pain that's elicited from your touch. So you will gently palpate the chest. Then posteriorly, you'll do the same thing. And no masses are noted. Next, you want to auscultate your lung sounds. You're going to put your stethoscope on. And we never listen over clothes. We also never listen over bone. So I'm going to gently palpate just to make sure I'm not over a rib. If you could take a deep breath in and out for me. Now I need to move across and listen at the same location on the other side, because I need to compare these lung sounds to the lung sounds on this left side. And if you could take a deep breath in and out. Now I'll move my stethoscope straight down. Again, not listening over bone. Deep breath in and out. And I'll compare side to side. Deep breath. Excellent. I'll move down and a little bit lateral. I'm not over bone. Can you take a deep breath in and out? And I need to listen on the left side, same spot. Deep breath. Excellent. I've noted that the anterior lung sounds are clear bilaterally. Now, posteriorly, you're going to listen a little bit different. We've got the scapula here and here. Again, we don't listen over bone. So we have to be careful to start at the apex and move in a C fashion. So we're not listening over the scapula, and we're not listening over the spine. No bone. A deep breath in and out. I'll move to the opposite side. Deep breath for me. I'm going to come down, making sure I'm not over the scapula or the spine. Take a deep breath for me. Move to the opposite side. And again. Move down on this side. Deep breath. And the same spot on this side. You're going to listen at least 6 places anteriorly and posteriorly. Make sure that you're never going below the level of where the bra strap would sit, because then you're no longer listening to the lungs, you're over some of the vital organs. His posterior lung sounds are clear. We've completed the neurologic and the respiratory systems. Now we're moving on to the cardiac system. The cardiac system has 3 components. The first is going to be auscultating the heart valves. The second is going to be checking capillary refill, and the third is going to be assessing pulse points. Let's begin with the heart valves. The first heart valve that I'm going to auscultate is the aortic valve. It's located at the second intercostal space, right sternal border. So I need to palpate the clavicle. Below that is the first intercostal space, then there's a rib, and the second intercostal space, and I have to move in slightly so that I'm at the right sternal border. I'll put my stethoscope there. And the S2 should be louder than the S1. Next, I'm going to come over to the left side. I'm going to palpate the clavicle, go down to the first intercostal space, feel that rib, and now the second intercostal space, left sternal border. This is the pulmonic valve, and S2 is louder than S1. I'm going to move down. There's a rib. Here is the third intercostal space, left sternal border. I'll listen. This is Erb's point. At Erb's point, S1 and S2 are equal. Murmurs are especially audible at Erb's point. Next, I'll move down. I feel a rib. I move down to the fourth intercostal space, left sternal border, and I'll auscultate. This is the tricuspid valve. S1 is louder than S2. Finally, I'll move down to the fifth intercostal space, left mid-clavicular line. I found the fifth intercostal space. Now I need to move across so that I'm at the midpoint of the clavicle. So it's fifth intercostal space, left mid-clavicular line. I'll listen. This is the mitral valve, and S1 is louder than S2. This is where you're going to listen for the apical heart rate, and you'll listen for 1 full minute. A second component for evaluating the cardiac system is capillary refill. What you want to do is find your patient's finger. If they've got fingernail polish on, you don't have to remove it. You can check on the side of the finger, and you just press until the skin is blanched. When you release, it should refill or turn pink again within 2 to 3 seconds. You want to check a finger on one hand and the other hand to make sure we have good blood flow all the way to the fingertips. And then you're going to do the great toe on each foot. Again, if the toenails are too thick, you can go on the side of the toe. Now we're going to check our patient's pulse points. When you're checking the pulse points, you're not counting, we're not checking his heart rate or his pulse. What we're checking is to see that we have good blood flow through each of these areas. The first pulse point that you're going to palpate is the carotid artery, and that's going to be in this area. You never want to palpate both of these at the same time because you could occlude the blood flow to the brain. We're going to check this one. And a normal finding for healthy pulse points is that they are strong and equal bilaterally. Next, we're going to move down to the brachial pulse. That's going to be on the inner aspect of the antecubital space. You'll go over and palpate the other brachial artery. Again, they should be equal and strong bilaterally. Next is the radial pulse. It's at the base of the thumb. We'll check the other side, making sure they're strong and equal bilaterally. Let your patient know that you need to pull their blankets down. Next is going to be the femoral artery. Keeping your patient covered, you're going to palpate. It's a deep palpation in the groin. Wear gloves when you're doing this. These are strong and equal bilaterally. Moving down, our next pulse is the popliteal pulse. That's located behind the knee on the outer aspect. And you'll check this side as well. Again, I'm checking with my 2 fingers behind the knee on the outer aspect. And these are strong and equal bilaterally. The next pulse that we're going to palpate is the posterior tibialis. That's located on the inner aspect of the ankle behind the ankle bone. And those are strong and equal bilaterally. The last pulse that we're going to palpate is the dorsalis pedis pulse. And that's located between the great and second toe, right here. And those are strong and equal bilaterally. Our next system is the GI or gastrointestinal system. Let your patient know that you're going to pull the blankets down and that you're going to raise their gown, giving them as much privacy as you can. The first step is to inspect the abdomen. I see my patient has a wound dressing. I'm also looking for possible distension, any masses, problems with the skin, moles, bruises, scarring. After I've inspected, I want to auscultate the abdomen. Normal findings for bowel sounds are 5 to 35 gurgles per minute. That doesn't mean that you listen to each quadrant for a full minute. You're going to listen to each quadrant, and once you hear bowel sounds, you're going to move on. If I auscultated no bowel sounds at all, I would have to listen for a full 5 minutes around the abdomen to ensure that there were in fact no bowel sounds. My patient has bowel sounds in all 4 quadrants. Now I'm going to ask my patient if he's having any pain in that area. I see he does have that dressing. He tells me he has slight tenderness where the incision is, so I'm going to be extra careful around that area. First, I'm going to palpate light, which is 1/4 to a 1/2 inch. I let my patient know if at any time he experiences increased pain to let me know. And his abdomen is soft. Now I'm going to palpate a little bit deeper. My patient tells me that felt fine. He wasn't experiencing any increased pain. And I'm going to palpate a little bit deeper to see if I feel any masses. So I'm going to palpate between 1/2 to 1 inch in depth. He reports there's no pain. And I note that his abdomen is soft, slightly tender where he has his incision, and that he has bowel sounds in all 4 quadrants. When you're doing your abdominal assessment, make sure that your patient is laying as flat as they can tolerate. You also want to ask your patient a couple questions about the gastrointestinal or GI system. You want to ask them when their last bowel movement was, and if they had any difficulty with that, any constipation or diarrhea, any blood in their stool, and if they had any problems with nausea or vomiting. After the GI system, we're going to move on to the GU, which is genitourinary. So this is where you're going to ask your patient if they have any trouble voiding, any pain with urination, frequency, burning, any nocturia, getting up at night to empty their bladder, if there's any strange color or foul odor of their urine. This is a good time for your female patients to ask them if they have any problems with their menstrual cycle, when their last menses was, and if they perform self-breast exams monthly. If it's an older woman, you can ask her if she's had an annual mammogram, and you can ask any female when her last pap smear was. For gentlemen, you can ask them if they perform monthly self-testicular exams. They can also perform self-breast exams, as men can get breast cancer. If it's an older gentleman, you can inquire as to when his last prostate exam was. And that completes our physical assessment.